Bismillah Rahman Rahim. Today we are discussing Mastering Insulin Pump Therapy Part 4. We will discuss on CareLink software reports in details, starting with assessment report, atrium, device setting, and logbook, besides others. This is my disclosure. The content of the lecture is intended solely for educational purpose and it is not associated with any kind of commercial promotion or sponsorship of the products mentioned. And as I mentioned before, we study CareLink Medtronic because it is the most available pump used in our centers without any bias. So the report, we start seeing the report. We start with the first page of the report, which make most of the information we can get it from the pump. This assessment and progress report. It's a full report containing four parts. These four parts is very crucial and very starting point. We can give you all the details which you need it. And later on, if you go to the other reports, you are just it support the feature which you see it will make more details as you want. Okay, so starting with this report, firstly, there is two segment value dates, segment A and segment B. Segment A create a last 14 days prior to the uploading of the system, and statement B is just the later time prior to that. In Medtronic, sometimes you have a lecture if you open the system to choose what segment you want to just compare. Comparison between segment and the other segment, it is such you can see not only the improvement, but it can be encouraging for the patient, especially if he change his behavior from such behavior towards a good behavior. You will see what happened when he do this maneuver. Okay, so the time frame, you will see about the time frame, and of course, reading the report, you make sure that the other colleagues download the right person, assuring by the right numbers of the patients or the name written above, because I hide it because it is for educational purpose. So like any report, make sure that you choose the right person and you discuss, and you choose the right segment of times you want to discuss. Because sometimes you will find previous downloads. Still, the educator or still the one responsible for downloading the data does not do the new one. So make sure that you are working in the right segment times. Okay. And then you can see now the graphs. Nothing is wrong regarding reading the paragraphs, which we all start from up or right or left, but after all, with your experience, you will see which of which, but the basic is the same. Some doctors starting with a statistic first. So statistics is very nice to be looked for. Others start with the AGB report first. So nothing is wrong. So you will exert your own way when you become more professional by times. Okay. So in the statistic, you will see, as I said, there is comparison from the current and the previous times. So you will just enhance the good behavior by seeing the number. This is the previous one. The smart card per week is only 44%. Maybe he's just now inserting before the manual mode and shifting to the smart card. I'm not sure, I will see in the reports. But overall, the smart card per week, we have a standard for that. Should be more than 90%, 80 to 90%, not less than that. Not permit to be less than that. Manual mode, he said one day, sensor wear again. The same statistic we use it when we are analyzing the previous CGM. Again, the sensor wear should be more than 80%. And here it will give you average glucose with standard deviations. There is average around 160. Again, GMI, which is a predictor of glycemic management index, look like hemoglobin A1C. If we said if this continue with the same behavior over the coming 3 months, the A1C most likely, if we check it, will be in the lab, it will be around this number. So now 7.1, which is excellent. Variations, we have the reading 31. We need it to be around 36. And But be aware from this variation. Sometimes it will be a good number, but good number towards the high level. All the reading is high. There is no fluctuations between the readings. This is why it will be a narrow. Okay. So overall, we need it to be less than 36%. Okay. In other words, that will mean we have a good behavior time. So if you have fluctuations, that means sometimes, as if sometimes he injects, sometimes, or he announces a carb, sometimes no. So it will give you great variation. So it will reflect the behaviors mainly. Low glucose, it will tend how many per day. And sometimes the glucose to be detected need to be more than 30 minutes in durations. Here again, they take about calibrations per day because sometimes the pump asks for calibration. The new pump, the sensor is manufacturer calibrated, but sometimes they enter, as we discussed before, they ask you to enter the blood sugars. So here she writes for you the total daily dose and how it was being distributed between our policies and autobasal one. And again, here there is autocorrections 11, 28%. We said autocorrections, we don't need it to exceed 30. And we said the importance of making the basal just if the patient is going out from the smart mode. Set change every 3.3 days. We said ideally should be 3 days with a reservoir change every 3 days. Meal per day, 5.9. There is a lot of snacking. We should discuss it with the patients. Carb enter per day, 200 over 82 every time. Go back to the daily requirement should be entered by the patients according to his age and pubertal state. Active insulin times is 3 hours. So this is very slightly, we said weak, or we said low threshold of glucose of insulin times because we have still area to work on. It can be 2 or 2.5. Okay, so this is the statistic of the patients. Then moving to the smart guard exists. There is no smart exists. And here is the right for you fully the cause of smart guard exists. Single AGB report as a time range. Time range first. Some doctors start with the time range. So firstly, they want to see what happened between the two segments. Here we see very nicely that the patients have time range 70%. And as a pediatricians, as we knew before, we start, our eyes go to the hypo first. So if you read for me this time range, you tell me there is no hypo before telling me about time range, I will be happy. I will see that you are oriented in pediatrics because we are concerned about hypo before al hyper. Okay, so most likely he was been improving during this time segment. Okay, and then you will see the ranges like an AGB report, which we see it in the CJM data. It shows you nicely the two lines. The blue lines is the new time frame, last 2 weeks, and the little bit fading orange one is the previous 14 days. And you see what this is the mean, and this is the dark blue shadow is a 50% of the readings of the patients for the last 14 days from 0 times to 0 times, and this is the interquartile line, and the other there is a fading one. This line and this line, interdecial line, this means 90% of the reading was being around these groups. But as we said, most of the time we take care about the interquartile line, this line. That means 50% of his reading for the last 12 to 14 days will go through this blue shape. Okay, so very clearly from the comparison between the two lines, these patients had improved better. That means if you see there are slight lines here for the blood sugars value, it's not clear on this screen, but he's hovering around these lines. Okay, so in a range, he's within this range. And seeing that the period of times without looking, he have some sort of hump here, maybe small here and maybe a little bit at night, high rest. So there is another nice thing, and I use it, this number, if you set N or this downward butters. It tell you about the hyperglycemia or hypoglycemia only in the last 2 weeks segment, is only on segment A. For here, very nice to look over it because it will summarize for you what happens in the curve quickly with a glance. So hypoglycemia pattern, he said 0. he didn't see any hypoglycemia during this segment time, but hyperglycemia better. He saw it in three time frames. He see 5 incidents. He put it by what notes, يعني one or every times. The frequent of accident, if it is high, it will start by one. So he see 5 occurred for the last 2 weeks, occur between the time 17 and 17:55, so 5 to 6 o'clock p.m. He saw 5 incidents, and then another one occurred at midnight, and another 3 occurred early morning, 6 a.m. So I just guess this may be breakfast. This may be a meal he took at 5 p.m. and this is overnight again because it is search for me. So I will go from this information. I will go back and see in the other records to support my idea. Is it a problem of a carb or what is it exactly? Okay, so from the first report, you know where you're gonna do. From the first reports, now you know there is little bit problems in the changing reservoir, exceed the time exactly, and I will just discuss his carb intake with the dietitians. And again, I have a room to work on. At least I have a room to work on the active insulin times if I want to intensify his blood sugars more. Okay, so the assessment progress. The second report I want to see the adherent reports because I will not analyze the pump which have a problem only, as I said, it is due to pump issue or adherent issue. Okay, so in a adherent report we have 5 icons, 5 columns. The first one about the glucose management, and it show you the blood sugar reading which patients enter and the sensor durations for he wear during daytime, is it 24 hours sleep. So very clearly here I will find one day, Thursday, 19th of Feb. He have blood sugars reading. He did 5 blood sugar reading, and the sensor wear is 17 hours only. So some sort of problem happened on that day. I will see it on the daily record what is happening there. Okay, and the sensor durations, it is only 12 days. Maybe it's because of this times here only 4 hours for the last time. And then I will go to the other icon of bolus event. The bolus event I will see with corrections or with food. Manual bolus is what happened. So there is a lot of manual boluses was being given. With the bolus wizard that meet with the pump suggestions. Okay. Then I will see the third one, the filling event of the cannula, of the rewinding. As I said, the cannula should be filled at least by zero point 0.3 units. So he filled the cannula nicely. Tube filling, he tube filling with the cannula, he do rewinding. A tube amount should be around 12 millimole. Here we have little bit tube amount, less than 12. So I will instruct the measures to make proper filling. Okay. Overall, the gaps came from this time. 3 because they said 3.3. So the gap came here on the last day. He did not change it on Sunday, Monday, Tuesday. Tuesday he should have been changing the infusion set everything. So this time he didn't change it. And we see the last things is the suspensions duration. Which time suspend durations? This is suspend by the patients. If by the sensor will be red color. Okay. Suspense time 5 hours 24. I know we said the allowed suspend time is a 2 hour. So most likely this patient have a problem in the sensor which was being created and doing this error. So the attendant report, as I said, we will just see what he can do with the pump infusion set and the boluses. I'll give you details about what is happening there. Okay. Then, before analyzing the pump, I want to see the patient exactly. He's on which insulin, how much the insulin he took it. Okay. Then I said I have to see this insulin regimen, this carb ratio. So I will interfere with the daily report and I will see what he did according what he missed. Okay. So these patients have basal the basal, he have three basal, 1.5, 1.2 during this segment from 0 to 4 a.m. His basal rate is 105. From 4 to 22, 1.2. From 22 until early morning, he have 105. And this is his carb ratio. He have only carb ratio for the day, sensitivity, logical cause, and the policy increment by default we know 0.025. Okay, his active insulin time, as we discussed before, is set, and we did maximum bolus 13 for him. Another patient, you will see his setting. You say this is the old one when we have the previous one before, smart card 780G. We can do with Lancet's basal, many basal during the pump therapy. You see basal 1 is active. We have a 4 basal per day, and we can design another basal for Ramadan times, another basal for exercise, another basal for if he get sick day like that. The basal will be ready, basal 1, basal 2, and the patient's only when he want to exert that mode, he will press on that and the pump will take automatically. Nowadays, 780G, no need to make many, only we have one basal, and one basal, we will make it at the time when we just installate a new pump at the manual mode. Then the pump automatically, due to our algorithm we discussed it before, she will do 80 basal and she will make everything nicely. Unless if it's go out from the smart mode, it will go back to this basal. So we need to see the basal from now and then. And this is a carb ratio he make for carb. Still in the Medtronic 780, we said we can insert a carb segment according to our desire. We can make many segments of carbs, and then the pump will do for us bolus correction. So correction جديدة, sensitivity is there. So simply, sometimes I go in the clinic and make some sort of paper like this. I do roughly scratch some sort of the time. I write up the carbs down, I write the basal rate, and I saw later on the record and decide, oh, this time is not good, this time need measurement like that. Because I cannot memorize the number, so I make it my scratch paper and then see. Okay. Then logbook, we used to see it before when a patient was on previous pump before a smart card. And as we said before, in the setting of the or follow-up of the pump, we need to test the basal by asking patients to fast specific times. Although the patients can can cooperate to do it, or you want to grasp these informations from the lab reports, which you have it by yourself. You will just try to find the times when the patients have only basal without interfering with carb, without giving corrections. This will be the easiest method to go overnight. So here overnight, the pump keep giving male boluses, male boluses, and all the night. That means the basal of that segment is good, not good. I forgot to tell you, if your blood sugars came as a high blood sugar, it came in a yellow color or orange color. If it come, of course, low, it will come in red. And this is the dark one is a carb intake, and this is the insulin dose given simultaneously to that carb. Okay, and the rounded one, it is a manual policies. Okay, if there is a green, that means the patient suspends the pump, maybe a fear of hypo or so. And if the sensor suspended, it will be red color. Okay, and this is the skipping bell. So from this logbook, there is time segment, of course, and there is daily record, how much he took every time. From this daily record, you can see his carb intake every day. If the carb intake here 120, 40, 54, 15. How he took a 15 carbs for 24 hours? So that means maybe he he didn't announce meal. Very clear. So from this icon of carb, you can guess that the patient he entered his carb or no. Well, because sometimes one day 33, one day 15 only. Another day he entered 329. So he need to be re-educated regarding carb counting again. Okay, and you will find again segment, you test the carb, you find segment. To test the carb, you want to find the segment where there is carb intake, and after it there is blood sugar, like this segment. But it was only 1 hour after he took the carb, and he did not write for us the previous, he did not enter the blood sugar. So it's very difficult to tackle and to say what he have here. Blood sugar is high, he give 14 years. We don't know what happened after. Okay. We face a lot of issue regarding okay. Another patient, high at 5 a.m. all the time. That means we skip meal. That means the previous basal is not good. Okay. From each end, we take a lot of time to see this teeny number. And if you want to test the corrections, we need high blood sugars before, as I said here. High blood sugar, how much insulin he give, and we'll see what happened. What happens the blood sugar? It's not corrected. That means his eyesight is no more good. Okay. For a logbook, it's very hectic, but sometimes you get good information from this segment. Okay. And for the carb ratio for this patient here segment, where he took a carb 80 grams, the pump gave 8 unit. The blood sugar is acceptable at that time, so he most likely his ICR is 10. So what happened after the blood sugar is raised to 117? That means we need to improve his ICR. Okay, and the weekly review, as I said, it will give you quick pictures about how, well, yani show you here, this icon, he's changed the set. So 1, 2, 3, change the setting, and it show you brightly the target blood sugar, which was being set by the pump. He used hundreds, and show you the graph of blood sugars, what happened during daytimes. It is 1 day, 2 days, and it will give you how much basal given and the boluses corrections. And here, when he took a carbs, and what does the pump suggest? Carbs does basal, suspend basal, then autoboluses. This is gray. Sometimes it will show you this gray icon for what? For smart guard disabled. They said smart guard to stop, the green one. They said disabled by user. And what happened here? It returned to this like footballer goals frames. هو اعتبر البيزل the previous program basal in the bomb. It gave it when the smart card was being stored, maybe closed by the patients. Okay, from the weekly, you will see from far the pictures. The picture is that he took a lot of carbs towards the evening, multiple carbs, raised blood sugars. Here, multiple carbs. So the blood sugars you saw, it was being raised whenever he entered carbs. That means his eyes are, whatever we put eyes are, the eyes are is not good, and we need to intense it more. Very clear. During sleep time, this okay, the pump is functioning well. You see here, it's okay to some extent, but the problem with entering carbs, okay? And sometimes when you see the weekly reviews, like the one we see it in the CGM, we will see the betters maybe Friday while he sleep, when he woke up by 12, the reading is shooting high. And Friday nights, with next Saturday, although he didn't eat, the blood sugar going high. So most time he did not announce a meal, he took it here. Okay, so weekend better can be seen in weekly review, and then later you will go and see. I highlighted every time the smart guard is have a problem, it will give you a just hint that I'm here. Okay, the gray shaded one, the light gray shading one, it tell you what happened. Saturday times, light shading one, the pump will exert, go out from the smart card, and he go back to his previous program basal for manual mode. And here she said why it was being out from the smart board, because the smart card exists to sensor is not available. Sensor glucose was not available. That's why it go out. Okay, and again, as I said, the pump give 4 hours before going to the manual mode. 4 hours give you alarm that inside blood sugar, inside blood sugar, inside blood sugars. Okay. And here, again, the blood sugar is going very high at that time segment. She given maximum basal rate, and she gave her policies, correction policies, and he announced the meal, and she gave 10 units of insulin, and the blood sugar is going down. During going down appropriately, it stopped from giving basal till the blood sugar again start to be corrected. So really he have a problem in the sensor or problem in the carb counting or ICR. Either to make sure that he had good carb counting technique, or I will improve, I write his ISR. If ISR is 10, as we said, we will change it 1 to 2. In this patient, I will make it immediately 8 because it's great surge of blood sugars after announcing carbs. And make sure that he announced the carb 15 minutes prior to taking his meal. Okay, so this is what, and this is the sensor change times the icon of sensor change. Okay, again, another patient where the pump was being out of the mode after he entered the blood sugars twice time is high. As we said, if the blood sugars is not matching with the sensor glucose, the pump ask you, pump give many corrections based on blood sugar was not correcting. She ask you enter blood sugar. If blood sugar is very high, the blood sugar is not matching with the sensor value. She will ask you to give another one. If the another one is not matching with the value, immediately will give you an error, and it will disable a sensor glucose reading from entering the pump, and it will go to the manual mode. So here she discussed with you, smart guard was maximum delivery for 7 hours. Blood glucose was required to continue in smart guard, and she gave a patient's alarm to enter blood sugars, and he was not responsive. This is why it was being get out from the mode. Another, if you go to see the weekly one, you can say just from the weekly one, which date you need to go thoroughly to review, because you have a 14 days. Or you can see the 14 days very quickly and decide what is the problem. For here, if you see the daily review, full details. As I said, Sunday time, patient was sleepy. He did not take any meal. Here, he took only 15 carbs, but whenever he woke up and eat appropriately, the blood sugars was going high, and the pump she tried to give maximum basal and auto corrections many times, but the blood sugar was being still very high. So the main issue we need to discuss with the patients, the carb entering. So the carb is the thing, but the basal overall is okay. But whenever he eats, meal policies results, we didn't say too much, but again, it can give you a good idea about every meal he take, what happened after 1 hour, or what happened after 2 hours. As we discussed in our mini-med, 780G. Nowadays, this is the predictions mode which shall Bob use it. If she give a policy, she will see after 1 or 2 hours what will happen to the blood sugar, and it will try to adjust it as much as we can. So patients adherent to carb count, noticing 15 minutes, it will give us good value for his blood sugar, either post-meal. So sensor and meter review, again, the average blood sugar goes, how much he wear the sensors. The view, we didn't review it too much, but it's there most, I'm sure that it have a lot of value to be seen. And here how the total daily dose distribute, total carbs. This paper statistic was being appear even in the first paper we reviewed already. Okay, and this is how much the blood sugars will go. You see in the icons of the manual, which is the monthly one, and you see how the blood sugar was being in this pump. Secret how much insulin dose the blood sugar value which was being given. Again, reading a pump depend about what items you want to, what segments you want to discuss, and by reading a lot of CareLinks reports, you will develop a good personalized, I will not say criticizing, but good personalizing, analyzing data for your patients to be, and every time remember that whenever we analyze things, we see hypoferic, then we will see the hyper issue, and we will try to address the behavior and discuss it with the patient. So my take home message, number guide us, but patients leads away. So you need to discuss every details with the patient, make sure he will understand everything very well, and use CareLink report to personalize the therapy, support informed decisions, and improve outcomes safely to your patients. Thank you. And this is the pictures of Sudanese lady who was wearing the white top, our traditional dress, which the white, per se, the white one will be worn most likely by the teachers, by the old ladies, by the eminent one, and it is very nice dress. The other lady will write colorful, but I like the white dress, which remind me by various teachers and the school times. Thank you. And I'm ready to answer any questions at any time if you contact me. And I will try to just make it as a registered video for anyone if you want to go back and review it. Thank you.